we really need to address the well-being of our clinicians first, right? As we start to help improve the whole health of the care team.
That's Dr. Tricia Wooden from PeaceHealth at the St. Joseph Cancer Center. She'll be back later in the show. Today, helpers seeking help. Normalizing mental health conversations for providers and cancer care team members. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. ACCC's recent summit on psychosocial care delivery in oncology highlighted the need to address the mental health of cancer care team members who regularly manage highly stressful situations. When providers can prioritize their mental health, they are able to provide the best possible care to their patients. However, social stigma and other challenges make it difficult for members of the cancer care team to seek support. Our guests today share their own experiences and resources to normalize the conversation around mental health. Dr. Christine Shaw is a radiation oncologist and system medical director for the cancer service line for PeaceHealth at the St. Joseph Medical Center.
So first of all, I think we have to start with awareness. And we know from national data that over 60% of physicians reported burnout in the past year. This is not surprising given COVID and the demands of patient care. Now add to that the normal emotional demands of taking care of very sick cancer patients. And you can understand why, historically, oncologists, while very well respected and valuable to the community, have always been considered very personally and emotionally strong to take care of patients and their families. With regards to addressing mental health care, I think, first of all, we have to acknowledge that oncologists are human, just like their patients. And so it's not unusual that in this day and age, with the stresses of the economy, COVID, and just normal daily life, that everyone benefits from good mental health. And just like physical health, you have to take care of your mental health. And just like physical health, sometimes we get taken advantage of by circumstances or our own personal vulnerabilities and need mental health treatment. And so what we've been working on in our program and in our health system is recognizing and not trying to deny the very human needs that physicians and caregivers need for mental health.
How do you speak to your team to encourage taking care of their own mental health?
I think number one is we have to be aware of how many people, not just in our patients, but also in our physicians and caregivers, are affected by issues such as depression, anxiety, and other illnesses. And just as if a patient came to you and reported severe symptoms of depression or anxiety, you would want them to take care of that, and you would want to help provide support. We can't do any less for ourselves. And speaking as someone who has also experienced depression and burnout in an earlier part of my career, it's really important to understand that you are not alone and that there are resources that are aimed to help you.
Can you tell us a little bit about your personal journey?
Absolutely. So I would say about a decade ago, as a solo parent, not a single parent, a solo parent of two adolescents, and having heavy responsibilities as a medical director and a radiation oncologist with a very full and busy practice, including research and administrative duties, I myself was experiencing burnout. And so I was very fortunate that I had some very supportive partners that helped recognize this based on their own personal experiences with depression and burnout, that they were able to direct me to professional resources that were available. I was able to, out of the support of my partners, able to take some family leave time off to address some of the needs of my family, as well as I was given the name of a very well-regarded therapist who was actually the former head for 10 years of behavioral health at the health system I was working at. And so he had left the health system. Actually, he had even set up the physician wellness and intervention program for the state of Oregon and had a practice that mainly consisted of nurses and physicians who had experienced similar problems. And so he was able to provide a lot of awareness and insight not only into the treatment and counseling for myself as an individual, but also in terms of the historical context of how organizations typically deal with physicians who are struggling with mental health issues.
Do you think you were facing any stigmas during your experience?
Yeah. So you're right. And again, it's been such a long time. It's hard to imagine because there's been so many celebrities that came out in support of mental health, like Demi Lovato talking about depression. Back then, it was my sister, who's also an OBGYN, who passed along some work that was being done actually in Oregon by a physician here named Pamela Weibel, who was one of the pioneers looking at depression, burnout, and physician suicide. And so it was news to me, the number of physicians that would actually result in physician suicide around that time. I was shocked to find out it was 400 physicians per year nationwide who commit suicide. And it's a problem that unfortunately has not gone away.
Do you think it's easier for women to talk about burnout?
So when I mentioned Dr. Weibel, a research on our physicians prone to suicide and depression, it was interesting. I found out through her research and others that a risk factor was being a single woman and not having that social support. I think, and I'm just speaking very freely here, I think that even in this day and age, no surprise, a woman who has a high powered career still has to do quite a bit of the mental load of a household and a family. You can still imagine that high achieving men, and let's just even think of a different industry like tech. You can imagine seeing a CEO or a CFO, male in, say, Silicon Valley. A very good chance he has a wife who is not working outside the home and can coordinate all of that, and he can go out and just do his thing. I would say that women physicians, and physicians tend to be caring by nature, it's not unusual for them to have families or be married to another physician because that's who they met in their 20s. And now you've got a dual physician career family with children. And most women will still have that extra load, even with a supportive spouse. In my case, I would say it was triplicate because I was a solo parent. There were issues with my children's father, and they were going through adolescence, which anybody who's been a parent through those ages knows is very challenging, even under the best circumstances.
Have you seen improvements in personal and professional well-being on your own team?
Obviously, coming from my own personal experience as a system director, I am the top leader in our cancer program across 10 hospitals. We have 4 integrated cancer centers in Washington alone. Our health system stretches from Ketchikan, Alaska, down to Southern Oregon and Florence. And so I had a personal commitment that any group that I lead sort of demonstrate the utmost in compassion and care and the empathy for what our young oncologists are going through as they struggle with financial debt from education, starting their own practices, and raising young families. I've lived that journey. And so that's where I see senior leadership playing an extremely important role. And so any decisions in physician recruiting, what programs that we take on, any feedback we get from patients or other providers, is always through the lens of really developing the best program and the best people.
What do you think is keeping healthcare from really embracing discussions around mental health?
I think there's a stigma. I think it really takes people having the courage to step forward and share their own human vulnerabilities, which we all have, and having learned lessons from that and having the executive ability to incorporate those changes within the program. I do think in healthcare, there is data that shows the most successful healthcare systems are not led by administrators, but are led by clinicians with the appropriate business training and making the appropriate decisions with the appropriate advisors. But at the heart of it, taking care of people is not like making sneakers, and it's not like making computers. And so behavior that is acceptable in the leadership of other non-healthcare industries will not fly in healthcare. And so I foresee, given some of the young physicians that I manage, a stronger desire to be at that leadership role, particularly women. And they are going out and getting MBAs and MHAs and sort of preparing for futures in executive leadership, which is what we need. We need people who have had that clinical experience, get the education, have the experience and tools and the mentorship to become successful leaders in a very challenging environment. And we require no less.
Dr. Cha works with our next guest to help cancer team members in their facility. Dr. Tricia Wooden is the System Medical Director of Provider and Caregiver Wellness for PeaceHealth at the St. Joseph Medical Center. How has your healthcare system opened up the conversation about mental health?
So in 2018, we recognized that well-being was an enormous problem, and we needed to start developing a system strategy to be able to deal with it. And like most healthcare systems, we do not have unlimited resources, and so we needed to figure out how and where we were going to focus and what that was going to look like. And so in early 2019, my role was created to focus specifically on the employed clinicians, so MD, PA, nurse practitioners who work for our healthcare system.
What are some of the key components of PeaceHealth's physician-focused behavioral services program?
So we have a partnership with Vital Work Life, which is a company that provides physician-specific or clinician-specific counseling, coaching, concierge services. And so that is our primary partner. That is the thing that is accessible to all of our clinicians that are employed by the medical group at no cost to them. It is 100% confidential and outside of any purview by anyone who works for our organization. And so thinking about partnerships for that is a critical piece, especially in a smaller organization, looking at what the benefits are through your EAP or through other resources through your human resource department can be an important way to address those mental health needs. One of the other programs that I didn't start but was brought up in the pandemic is a psych first aid program. And so there is a phone number that a clinician or any staff member can call if they're experiencing distress, and a clinical psychologist answers those calls and provides them with just-in-time or acute stabilization and resource direction.
As you lead this well-being initiative, what have you learned about the value of addressing mental health in the workplace?
So really helping clinicians understand where their power is and helping them to feel better has wide-reaching implications on the care of our patients and the way that they show up and function within our care teams as well. And so it's really difficult as a non-clinician to work for a clinician who's experiencing mental health issues and burnout. And so to some degree, we really need to address the well-being of our clinicians first, right? As we start to help improve the whole health of the care team, really hard to do that if we're not focusing on our clinicians. And yet, there's still a lot of clinicians who don't really think this is important, or they want to do it themselves, or they think that they don't really need it, or that it's not really going to help. And so the more people we have that have started to embrace not just treatment of mental health disorders, but really more pursuing wellness, so that pursuing of excellence or that pursuing of an improvement in their life, actually we're starting to see those benefits come back in terms of how our clinicians respond to changes and what their willingness to bring forward ideas that help improve our healthcare system overall.
What have you learned about the role of leadership to change the culture around mental health?
So I think leadership and well-being are intricately linked. And so the first thing I say about leadership and well-being is that if you as a leader are unwell, and many of our leaders are burned out or struggling with their own mental health issues, I also just want to be really clear, I separate the two. I think that there are mental health diagnosable conditions, and then there's your personal well-being. And those two things can coexist, but they're also very separate. So speaking specifically to a leader's well-being, their department will accurately reflect their personal well-being 2 years later. So the well-being of our leaders is not a fluffy afterthought or something we should be taking for granted. The well-being of our leaders needs to be something we help our leaders understand that it's very important for them to be investing in their own personal well-being, they become quantitatively better leaders when they do that. They are able to make better decisions. They're better able to hear objections. They're better able to problem solve and help people who are experiencing stress or distress, and their behaviors directly contribute to the health of the workspace. So that is my first comment about why leaders are really important. We know for sure that the ability of a leader to lead is critical for how the well-being of the workspace is. But one of the things I think we don't focus on enough is that the lever that you have to pull first is helping those leaders be well.
Do you have any tips for cancer programs with tight resources?
So I want to be really clear that we do what we do with not a lot of resource. I'm the only one who has any FTE designated to do this work. And it really takes having it become a priority for the people who are leading your organization. So the first thing is helping them to understand why well-being is important and why investing some time, at least, if not dollars, makes good sense. The second thing is to really take an assessment of your space using some model that's available. The Stanford model is the one that is most recognized by the AMA. The AMA steps forward, has resources for organizations, gives them good places to start. I strongly recommend all of those. But then once you identify what the overall strategy is, you really want to take stock of where you think you can make the most difference or where you think the biggest need is. And then what I recommend people do is focus on one thing and only one thing. And just do that until you have that at a place where you can then think about another project. And so, as counterintuitive as it might sound, the first project we did was on clinician onboarding. And it was because we looked around our space and realized that the way we welcomed clinicians into our medical group was haphazard at best and disastrous in cases. And we really needed to improve that and to help our clinicians feel like they had what they needed to get started in their practice. That was a really big initiative, and it's taken us multiple years to actually be able to implement fully. But we didn't start on project number 2 until that project was very well developed. And in that way, we've been able to tackle about one major initiative a year to be able to help get us to the place where we are today.
How can programs adjust to address mental health so they're meeting the needs of all of the members of the care team and not just the clinical team?
That's an outstanding question that we struggle with still. I think that many of the same principles apply, thinking about things like how do you make sure that the care environment that you're practicing in or that you're expecting people to show up in is more calm and less chaos? What behaviors are we doing that contribute to the chaos? How can we make systems function with better ease and less noise? What resources do your caregivers have? Do they have access to basic mental health? And then what do those look like? How easy or difficult are they to access? And then finally, thinking about professional development for all of our staff members. You don't really know what your medical assistant has or your nurse has in mind as a career path unless you ask those questions. And many times as clinicians, we just don't think about that at all for ourselves. And we certainly don't think about it necessarily for our staff members either. I personally have a medical assistant who is very ambitious and he wants to become a registered nurse. And I know when he becomes a registered nurse, I'm going to lose him. And so there's a strong disincentive for me to invest in his professional development. However, if I want to keep him employed in healthcare in our settings, then I need to be thinking about how can I help him be positioned better to get to that career aspiration that he has. And I think some of this, especially in smaller systems, would be the clinicians really taking that on as something that they do, again, first for themselves and then for the rest of the care team.
Thank you, Drs. Cha and Wooden. You can check out the show notes for more resources to address mental health within the cancer care community, including a report from ACCC's Call to Action, Delivery of Psychosocial Care in Oncology Summit, supported by Beijing. If you like what you're hearing, go ahead and follow the show right here on your favorite podcast player. That way you'll know as soon as there's a new episode. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Community Cancer Centers.